warm welcome to all of you on behalf of Access Health International. I'm Girish. I will be the host and the moderator for today for this webinar. Good to see all of you, and thanks for joining for the webinar today. I have distinguished speakers, experts, and partners, and all the audience in the online who are joining today on the occasion of World Hepatitis Day, which is tomorrow on 28th July. As part of that, Access Health International is working towards the launch of today, the Stop Hep Alliance. It's a global collaborative which is committed towards the elimination of viral hepatitis, which is a public health threat, and as stated by the World Bank and globally to eliminate by 2030. So as an alliance, we are looking at how do we really work towards its prevention, awareness, early detections to make sure the world is has an elimination in that direction. Having all these distinguished speakers and experts today, I have the honor to invite you for to have your message as part of this Alliance launch, and also a call to action for the Alliance to take measures and steps to see its goals and achieve some of its objectives. I thank everyone once again for joining today, and taking this opportunity, I welcome Dr. William Hasseltine, Chair of Access Health International. May I invite you, sir, for your opening remarks, and welcome for this webinar. Thank you. Over to you, sir.
Thank you very much, and it's a great pleasure to be here today on the occasion of discussing how to end hepatitis B as an infection in the world. We are very fortunate to be joined by Hala Zaid, who was the health minister of Egypt at the time when hepatitis B has been eliminated. She played a key role in the elimination of this disease. The work is especially important as it is proof of the concept that hepatitis B can and has been eliminated from an entire country. It's significant that of all the countries in the world, Egypt has had the highest incidence of hepatitis B in the world. And today, the World Health Organization has announced that hepatitis B has been effectively eliminated from that country. That means that people no longer suffer the consequences of chronic hepatitis B infection and are no longer infected at any appreciable rate in the country by people who live in that country. So that is the definition, and all thanks to Hala Zaid, her wonderful work in Egypt and for Access Health in bringing together this very distinguished group. As you will see, I have written a book on how to eliminate hepatitis B from the world, as well as other chronic infectious diseases. Now, it's extremely interesting that hepatitis B is not a disease you can eliminate with vaccines. And that turns out to be true for many other diseases, HIV in particular. Coronaviruses, as another example, are not, or influenza, cannot be eliminated by vaccines. They can be controlled sometimes by vaccines, but they cannot be eliminated. Both influenza and coronaviruses change daily. I also, in the book, outline a series of steps that are necessary for any country to eliminate a disease such as hepatitis B from the country. The first and foremost qualification is a recognition by the world and by the country that it's a serious problem. Certainly that happened in Egypt with hepatitis B, but it happened around the world through a long effort of scientific discovery of the cause of the disease, the virus, the nature of the virus, and finally, the concerted work of biotech and a number of pharmaceutical companies to develop drugs that could effectively eliminate hepatitis B from an infected person and prevent that person from transmitting the virus. So a prerequisite of all of this is recognition by the world of the serious nature of the problem and the combined efforts of scientists and pharmaceutical executives around the world to develop the drugs. I would say that is the items number 1 and 2 of the steps for any disease. Now, that has been done for HIV, for example, remains to be done for influenza and for coronaviruses. We have some vaccines, but we don't have drugs that can eliminate the infection. Despite the fact that there are many targets for drugs in many of these viruses, except for in the case of HIV, there is no real concerted effort to develop the drugs necessary to eliminate these. The third, I have to say, is money. It takes money to develop a program within a country. In each case of Egypt, it was the World Bank that provided a loan of no more than $250 million to catalyze a program to eliminate the disease. Now, of course, the money is dependent on the cost of the drugs. One of the very important aspects of controlling any infection such as hepatitis B is making the cost of the drugs low. In the case of Egypt, the cost that was available before real negotiations was $1,000 to $2,000 a dose, which was eventually through collaboration with India and other companies down to $40 to $50 per dose per person. So the cost of the drugs is key to control of epidemics. And that's true of HIV. It's true of coronaviruses. It's true for any disease for which we want to control. We have to get drugs that work and that are very low cost, which is a very high barrier and requires special international agreements under some circumstances, such as those that were used for hepatitis B. Hepatitis B is now a disease. If there is appropriate negotiations, the countries can develop these drugs at very, very low cost. Finally, it's not finally, but leadership is really important. And without the proper leadership, a country cannot hope to control a disease such as hepatitis B. Egypt is fortunate in having Hala Zayed as the health minister and the president, President Sisi of the country, behind the effort. This, I visited several times during the effort, and I can tell you there was an all-out effort to convince the population that the disease was one that could be and should be and must be eliminated. The president had banners with his own face, his picture, on the banners all across the country, and that was absolutely essential. So leadership of the public health sector is an essential ingredient for control of the disease. Then, of course, there has to be a health system that can develop and deliver the drug free of cost to people who are in need. That is a criterion which most countries lack. Most countries today do not have a system to develop a drug, even if it's going to be effective. Even if there is leadership, they don't have a system that can develop can deliver an effective treatment and monitor that treatment for the entire population. I would say of all the criteria that's essential for elimination of hepatitis B, that is the critical difference. In the US, for example, the cost is prohibitive. We don't have a system to identify those who are infected. We don't have a system that's going to tell us that the drug has worked. That system was put in place in Egypt. Then, of course, there is the development of the plan. And for that, I give Hala Zayed enormous credit for the ability to create a coherent plan for the treatment of the entire population. As I say, I visited the country during the elimination of hepatitis B and watched both the creation of a plan to treat everybody who was in need in Egypt. That was about 400. That was about 4 million people that were found to be in need of the treatment, and both the cost of the diagnostics and the cost of the drugs, the finger stick that was doing the serology, the PCR that was a confirmatory test, and the availability of the drugs. All that was done on a minute-by-minute, country-by-country, village-by-village, person-by-person effort. And it was all recorded in a wonderful AI system put together especially for this program. And finally, of course, was the execution, which in the case of Egypt was meticulous. The execution of the plan and the people who executed the plan, the young people, the older people, the people in the diagnostic facilities, the healthcare system, were absolutely amazing in how they executed the plan. It was an example of humanity at its best, helping each other. With that, hepatitis B, with all these 7 points that I outline in my book, and in fact took place in Egypt, you can eliminate hepatitis B in any country. And I know the United States has plans at exorbitant costs, $11 to $14 billion, and it's unlikely to work. But there can be plans put in place across the world which will work. Let me point out that hepatitis B is not the only disease we've got to control. There's still, according to the UN, about 40,000 people infected with HIV. There's no reason we can't do what Botswana did, a very small country, which eliminate HIV as a source. The famous equation, undetectable means untransmissible, is true for many diseases, including hepatitis B and HIV. We can eliminate it. There are drugs that, without a vaccine, will allow us to eliminate HIV, and that's an important program as well. Also, the papillomaviruses that cause an epidemic of cervical cancer in women and head and neck cancers and other cancers in men can be eliminated, in this case with a simple vaccine. It looks like one shot will do the job today. So a program to eliminate hepatitis B can roll over to other diseases as well. And I might say that one thing that's not really recognized as well as it should be during the course of hepatitis B elimination. Egypt also measured everybody for hypertension and gave them free treatment, a disease that kills many people around the world, a chronic disease. They measured the people for diabetes and offered free treatment for diabetes as well. And today, not possible in those days, with the hepatitis B elimination, you can control obesity, which is also controlling diabetes, heart disease, brain disease, and many other diseases through drugs. We need programs to eliminate all of those. So hepatitis B elimination, the example of Egypt, is a shining example of what can be done for many of the chronic illnesses throughout the world. Science has done its part. It's now up to organization and the governments to reduce the costs, to create the organizations. Such has been done in Egypt. And we're fortunate to have as one of our key people today, Hala Zahid, who is the head of these programs. Thank you very much for your attention.
Thanks, Dr. Hasseltine, for your important inputs, but also I think it's a must learning, which could be taken up by various countries. Thanks for your inputs. I have now the honor and to invite the champion and the leader for the hepatitis program, not only in Egypt, but across the world. I welcome Dr. Hala Zaid, who is the Regional Director for Access Health International and a former Minister of Health, Health and Population at Egypt. Over to you, Dr. Hala.
Thank you, thank you, Girish, and thank you, Dr. William, for your kind words, and thank you for you and Dr. Reddy, and for Meg and Finn, who believed me and who supporting me to go to the world to replicate Egypt model. Please share my presentation. And at the first, I would like to welcome with with our esteemed guests, distinguished speakers, and dedicated partners. A very, very warm welcome to all of you for joining us today for the launch of the Stop Hepatitis Alliance. Our vision is towards a world free from hepatitis. The Stop Hepatitis Alliance is dedicated to supporting and accelerating global efforts to eliminate hepatitis B and C by providing clinical and operational support to existing initiatives. We aim to bridge the gap between research and the implementation. As Dr. William mentioned, the execution, very important, ultimately achieving the goal elimination target. Again, I would like to thank all of you for joining us, Dr. Homi, Dr. Shireen, Dr. Reddy, Finn, my dear Mustafa Muharram, and of course our symbol and the icon, Dr. William Hazeltine. Access Health International is an NGO established in America in 2007. Access Health is an international think tank, advisory group, and implementation partner. We believe that all people, no matter where they live, no matter what their age, have the right to access high quality and affordable health care and to lead healthy and productive lives. As I mentioned, it's NGO established, it's founded by Dr. William Hazeltine in America in 2007, and there is a lot of regional offices, 2 offices in India, and regional office in Singapore, and the newest one in MENA region. The CEO of the global CEO of Access Health International is Dr. Reddy. Thank you for joining us, Dr. Reddy, and for your leadership. We are working on health system research, advisory, advocacy, and capacity building. As I mentioned, this is our the executives leaders in Access, and this is the board, esteemed board of directors with a lot of unique scientists from Stanford and Yale, as well as unique persons like PD and a lot of health leaders from different areas in the world. We as Access Health International working on different public initiatives. We are working in business aspect, but also we are working on different public initiatives, Stop Hepatitis Alliance, African Cancer Care, GLC MENA chapter and GLC globally, AI Solutions, Rare Disease Alliance, and the Asia Pacific Cardiovascular Disease Alliance. We need to study more and more the Egyptian model. The presidential initiative 100 Millions Healthy Lives campaign is a remarkable and giant step that can convince all the world it's achievable. When we are talking about Egypt experience, Egypt had the highest prevalence of hepatitis C in the world before 2018, with annual economic burden of HCV was $3 billion with a World Bank report. We, with extraordinary leadership from the President Abdel Fattah al-Sisi, we launched and achieved the campaign of elimination of hepatitis C and also screening of all the population, 100% of population above 80 years old from non-communicable diseases. We screened and treated and achieved the elimination with only $256 million loan from the World Bank over 40 years payment. Some figures, very important figures, where the average screening per day was 240,000 citizens per day, with more than 7,486 healthcare facilities, primary, secondary, tertiary, private, public, NGO, and the average testing of PCR was 36,000 testing PCR per day. We screened more than 70 million of our population. We achieved the target of population above 18 years old, but also we screened the children in the preparatory school and high school and the first year of college for 5 years. So we screened more than 70 million of population. The campaign started in the 1st of October 2018, and the last day was April 13th, 2019. We received a lot of support from WHO. WHO worked as external inspector on the campaign with more than 30,000 working hours among the duration of the campaign. And Dr. Tedros Adhanom attended, and His Excellency, the President Sisi, received him at the end of 2019 to receive the 3 volumes of verification reports. And after inspection more and more and achieved not only the screening, but also the 10 criteria of elimination from hepatitis C, we are so proud to be the only country in the world who received the golden tier of elimination from WHO. So based on this experience, we need to support the world. All of us know that there is more than 304 million people living with viral hepatitis B and C. This is according to the WHO report that issued in at the beginning of 2024, with different distribution all over the world and burden on all health systems. The problem statement of hepatitis elimination is lack of political commitment, as Dr. William mentioned. The presidential commitment, very important. Fragmentation of international support and advocacy, improper stakeholder communication, high cost of medication, prevention challenges, inaccessibility to screening, diagnosis, and treatment, lack of awareness and medication, inadequate health infrastructure, and limited resources. We will, our goal and objectives is viral hepatitis elimination, reduce mortality and morbidity, hepatitis C and B, advocacy and policy change to support the elimination, community empowerment and awareness, and equitable and universal access for the diagnostics and treatment of hepatitis C and B. The key pillars of work, either clinical, technical, and operations, will be on 5 pillars: advocacy awareness, operational assistance, clinical and research, fundraising, which is very important, and partnership and collaboration. This is also very crucial pillar where all the people have to work together, either internally or externally. I mean the NGO, the national bodies, NGOs, societies, private sector, as well academia, as well as the international and multilateral organizations. We have a lot of partners. We are so proud to be the strategic partner for Hepatitis Fund. Thank you, Finn. Thank you, Meg, for your commitment to support this initiative. The WHO, the regional office of WHO for EMRO region, for Euro region, our partners, the Uzbekistan Ministry of Health of Uzbekistan and Virology Institute of Uzbekistan. Thank you, Dr. Erkin and Dr. Laziz. You are the right leaders and who can lead their country for the elimination. Thank you, Muharram and partners, for your contribution and your support. Thank you, the Federation of Egyptian Industries and the Ministry of Health and Population of Egypt, where the Minister of Health and Population, His Excellency Dr. Khalid Abdel Ghaffar, approved to receive all the people from all over the world for the training clinically and operationally in the Ministry of Health and Population for free. And thank you for the Pharma Chamber. And also I would like to thank you, my dear friend, Dr. Shireen Hilmi, the CEO of FARCO. We have a target to support these countries with high prevalence, starting from Pakistan to Malaysia. We need to support all these 15 countries. If we will support these countries, then we can achieve the elimination for more than 60% of the population all over the world. Again, I would like to thank Dr. Erkin and Dr. Laziz and His Excellency, the Minister of Health and Population, Minister of Health of Uzbekistan, and all the stakeholders of Uzbekistan for receiving us and signing with us since 3 months ago to support Uzbekistan in their journey for the elimination. And I think Dr. Erkin and Dr. Laziz, the next year we would celebrate the giant step for Uzbekistan towards the elimination. Maybe the next Hepatitis Day in 2025, I think you will lead this webinar to celebrate your achievements. Thank you, Finn. Thank you, Finn. From day one, when we contact you supported us. Thank you, Finn, for your leadership and your vision and your passion to support this initiative. Again, Access Health International Stop Hepatitis Alliance is coming to bridge and enable all the initiatives worldwide to achieve the elimination and to mobilize the resources and funds for Hepatitis Fund to support different initiatives and countries worldwide. Thank you, Dr. Meg, and all the people of WHO in Geneva who are responsible on the infectious diseases and hepatitis C and B. Thank you for your support, our initiative, and your participation with us. Again, thank you for all the Egyptian partners, FARCO, the Federation of Egyptian Industries, and the Pharma Chamber, as well as Ministry of Health and Population. We aim to provide the world with this partnership with WHO and Hepatitis Fund with three important documents. The first one, the toolkits for elimination preparedness of the countries. The second document is operational manual for the elimination. And the last one is achievements or toolkit for to assess the achievements of elimination. We together we will work to mobilize the funds to support the Hepatitis Fund in Geneva, and we will work together to bridge the research and the
Dr. Hala, please go ahead. There was a small lag. Please continue. Dr. Hala, can you hear us?
Yes, I can hear you.
Yeah, please continue. There was a small lag, so it got stopped. I think please continue.
So again, I like to focus on this moment to viral and movement to viral elimination in 4 key areas of awareness, fundraising, political will, and the technical expertise we have. We are here to enable, align, and support fundraising efforts through Hepatitis Fund and enable it to reach to access to various countries of priorities. Thank you for all of you for your attendance and sharing us such a great moment. Thank you.
Thanks, Dr. Hala, for your extensive learnings and sharing, and for this inputs as part of the collaborative. We thank you for your time and also sharing your experience. For the launch of this Stop Hep Alliance, for a moment, if all of you can switch on the video, we want to have a group photograph. If all of you can, please kindly switch on your videos for a moment. Stuti, you can suggest if it's okay.
Yes, I've got it. It's fine. Thank you.
Okay. Yeah. Thanks, everyone. Thank you so much. Now we move to our next speaker, and we had very fruitful discussions with the WHO and been a very kind partner for the Stop Hep Alliance when we met them. Dr. Meg, who is the Director, Department of Global HIV, Hepatitis, and STI Infectious Diseases Program at WHO. She is unable to attend in person, but she has a message over a video. Would request our communications teams to play the video, a message from WHO for our support towards this Hep Alliance program. Over to the video, please.
So happy to be with you, even if it is through a video, because I'm so excited to hear about the Stop Hepatitis Alliance. I've been asked to provide you with just a brief overview of the global situation in terms of targets and how far we are towards reaching our hepatitis elimination goals. So we are guided by the global health sector strategies on viral hepatitis, and these take us between 2022 and 2030, and those strategies were endorsed in the World Health Assembly again after our first endorsement in 2016. This year, we put out a progress report to show us where we are towards 2025, just a year away, and we have 2030. I guess now 6 years away. So it's quite important in this mechanism and work that we're sharing with you here is that we look for country ownership and also partnership, because we do have a ways to go in hepatitis. However, I always say that hepatitis B and C are the most likely infections to be eliminated by 2030 because we have a vaccine and prevention for hepatitis B, we have a cure for hepatitis C, we have access prices, and what we need is now not just political will, but we need political action. So under our strategies, we have 5 strategic directions to deliver high quality services, optimize the systems for impact, generate data and use that data, engage communities and people living with hepatitis, and foster innovations for impact. And we have several targets, and within that strategy, you'll see that we have impact targets on reduction of new infections or reduction of incidence, service delivery targets, and also targets around burden of disease and reduction of deaths. So you can see there on the left that what we're aiming for is a reduction of hepatitis B incidence to less than 0.1% in children as a proxy to removing new infections in the community through either immunization or preventing horizontal transmission, reducing hepatitis C incidence down to less than 5 per 100,000, and a combined mortality reduction to less than 6 per 1,000. And these you will find in our guidance around how to be certified for being on the path to elimination. We also not only put out a progress report on our where we are on the 3 diseases of HIV, hepatitis, and STIs, but we had a very comprehensive hepatitis report, which looked at both the epidemiologic status as well as where are we on access. And it merged together nicely because we could see where we're far behind, which countries are having very good access or limited access, and where we need to push. And so we had data now from 187 countries, where in the past we were at best at 42 countries. And we have quite a bit of good information about how less than 25% of countries are accessing the best prices for diagnostics, the best prices for hepatitis B and C treatments. Here's the big data that I think you might want to see. In 2022, we have 304 million people living with chronic hepatitis. For hepatitis B is 254 million, and for hepatitis C, 50 million. There is a decrease, which means we're doing something right, but the devil is in the detail on the data. So when we look at our impact targets for hepatitis B incidence, new infections are not declining fast enough. As you'll see that green line needs to come down much faster to get to our targets. And hepatitis B mortality is unfortunately increasing by 34% due to low treatment coverage. This is a trajectory we can't live with. For hepatitis B, C, we're in a better situation where incidence is declining, but not fast enough to reach our targets. And hepatitis C mortality is declining, driven, we think, primarily by the increased coverage from Egypt, which is a huge boon. And we can say thank you to our host as well for helping to get that in motion. For hepatitis B, incidence as a proxy of prevalence of surface antigen under children age 5, we met our 2020 targets except for sub-Saharan Africa. So globally we're on track, but sub-Saharan Africa must introduce a Hep B birth dose to have to make our targets by 2030, which currently right now we're not near there. So overall, services, this is the challenge we have. Less than 13% of people know their hepatitis B status, and of those, less than 3% are on treatment. For hepatitis C, 36% of people know their status, and around 20% of them are on treatment. We need to change that trajectory. And if you look at this slide, it tells us by WHO region, which regions are ahead for Hep B and C, which regions need our support, and how far they need to go to make the 2025 targets and the 2030 targets. Lastly, when you delve into our report, you'll start to see where are our challenges. We had great progress, but still we have challenges in the birth dose, as I mentioned before, for Africa primarily, and for the regions of all around with working with people who inject drugs. We are nowhere near providing enough prevention for people who inject drugs with either needles and syringes per year. So, in summary, the time is now to implement the recommendations of the Global Hepatitis Report and also on World Hepatitis to remember that we have to do this together. We need to reduce mortality, reduce incidence. We need to increase service coverage. If we focus on at least 10 of the high burden countries, we could get ourselves back on track by 2026. So we need there's 2 years of a window of important time where we need to have actions. The cost of inaction is huge. If we have increasing cancers and deaths related to hepatitis B and C, it could be at 2 million by 2030 and up to 2 million now, but up to 15 million later, and we could lose up to 23 million lives if we don't act. Again, the window of opportunity is now, and we're really glad that we have such a group of speakers who can take that forward. So with us, thank you very much for the invitation. WHO is with you on this World Hepatitis Day. Thank you.
Thank you, Dr. Meg. Thank you, WHO, for this presentation, and also a keen express interest to work with this Alliance and Hepatitis Fund to ensure that action is speeded. We thank for their support for this Alliance. Now I have the privilege of introducing the Mr. Finn, who is Executive Director at Hepatitis Fund, who is championing the hepatitis program through a platform on fundraising. Thanks, Finn, for joining us. Over to you.
Thank you so much, Girish, and thank you, Dr. Halla, for inviting the Hepatitis Fund to be part of this call to action today. Thank you, Dr. Williams, chairing, opening this session, and putting out the sort of backdrop of the challenges that we are facing. So I'm representing, or by representing, the Hepatitis Fund, we are supposed to be the focal point to fundraise for elimination of viral hepatitis. It's important, as all speakers have mentioned today, the lack of funding is unfortunately enormous. It hasn't increased during the last year, basically because what we have seen as inaction of government. We see the lack of commitment from government. We see the lack of local commitment from their own country. But specifically, I think that sort of crossover to go beyond your border and help other countries is something that we really don't see today, and something that we need to see. Egypt is a great sort of number one to lead us, absolutely through what they've done, but also through what they interest to help sub-Saharan Africa, help the countries to speed up the elimination process. The Hepatitis Fund has recently signed an MOU with Dr. Halla and Access Health International. I think that is the first step. With the energy of Dr. Halla, hopefully with the energy of myself and others, we will manage to address this issue more clearly, more strongly to government. We fundraise towards private, corporate, family foundation, anyone who has the interest to improve health of individuals all over the world, as we have said and agreed to under the Sustainable Development Goal. Target number 3 is to eliminate viral hepatitis. Today, in 2024, we are not even close to following that part. So my call, not only to myself, all the members of the meeting today, all of you listening, and all governments around the world, is to take action, take on the responsibility that sits on your shoulders together with us. As we've heard doctors and professors and the likes before me saying, we have all the medical availability needed. We have drugs, we have medicine, we have vaccine, we have everything that we need to come to the final close in 2030, but we have to act differently to what we are doing today. We have to act strongly, stronger, and more widely throughout the world. Dr. Haller had raised 15 countries of focus. Of course, there's more. I think the report from WHO includes 67 countries, which has a huge problem of viral hepatitis. So it is a worldwide, a global problem. Even if we look at only Africa and Asia as the focus, where you have the highest prevalence, we need to see to all countries. It's the same as with COVID. If your neighbor has it, you have it. It's not something that we can shy away from. We have to act on that together. So use Dr. Haller and myself, use the Hepatitis Fund, use Access Health International, use the tools available specifically for the fundraising side. As we have the medical side is already there. We are talking with pharmaceutical companies. We will negotiate lower prices all over the world. We already have done this with several pharmaceutical companies, and we will continue to do that. But use us as the tool, as where everybody should go and have these discussions. We will start in the Middle East, on the Arabic Peninsula, with government discussion, as we are already there doing this. We want to embrace new possible opportunities, new donors that see that there's a seat to be leading towards elimination of viral hepatitis. That seat is not taken today. We don't have a Bill Gates Foundation in elimination of viral hepatitis, but we need it. We need something similar. For me, it's only the government that has the leverage and lifting capacity to go there. So that is where we have to be addressing. Pharmaceuticals, private, corporate, individuals don't have the capacity to do this. We need 3 to 5 governments with strong interest beyond their own borders. Egypt has been leading, and now we need more. That is my call today. That is why my voice to the world and to all of you. Come together. Remember that the funds, it's not the only thing, but it's vital and it's needed if we want to move this forward. Thank you so much for inviting me, and thank you for listening to me.
Thanks, Finn, for your wonderful message and a very clear call to action. Thank you so much. Now I will move to our next speaker, who has been a champion for access to medicines and across the globe, and especially in hepatitis. He's been championing in Egypt and across other countries. I have the honor to welcome Dr. Shireen Helmi, who is the CEO of Farco Corporation. Over to you, Dr. Shireen.
Thank you, Girish. Thank you, Dr. Haller, and thanks to everybody. It's really an honor to participate in this. As you said, we have now 50 million patients, and to cure them in 6 years, we need 8 million per year. This is very important, and from our experience, we had a very important thing is the discoveries, how to make it happen. The first kilogram of sofosbuvir we bought for $1 million, and we produced 10 kilos for $1 million, then 100 kilos, then a ton for $1 million. So we got the cost down to 1 per 1,000. We have to now work win-win, because to cure 8 million a year, this means we have to cooperate and to plan. Proper planning prevents poor performance. So how to get the cost down? Is it the egg or the chicken first? It's the economies of scale. The more we produce from the API, the more we can get the snowball rolling and get the cost down. So if we really can make some sort of a plan and give tasks, for our capacity for Farco, we can produce up to 3 million patients a year from the 8 million, which is good and substantial. But we need to plan with the funding and the quality. As you know, Farco, we got a WHO pre-qualification for the API plant and for the finished dosage plant and for the dossier itself. We also had a new chemical entity, which is Ravidasvir, because the soft DAC, which cured 97% from genotype 4 in Egypt, it cures only 86% of genotype 3 in Southeast Asia, where there is a lot of patients now in Indonesia and this area. So we had Ravidasvir, it's now registered in WHO. We work together with DNDi, with the government of Malaysia, Dr. Noor Hisham, Director General of Health, and we made the success story of having a new chemical entity that can cure hepatitis with very high cure rate. So I think planning, and we have to have a common goal that we all work together with synergy, and I think together we can. Dr. Hala Zaid made a great effort for mass mobilization, for motivation. She made advertisement in the TV with very big singers that they really mobilize the people. Do you know, in 18 months to mobilize 70 million people to go and analyze? And this also is a very important task, because checking the weight, the height, the blood pressure, and the blood sugar, it's very easy to do if you have the system. And at the same time, the whole world will have a data bank for how to really make good health insurance for the people. So it's not only curing Hep C and B, but also making a data bank. Also, the diplomats like Leo Messi, the Argentinian football player, all these really made a real mobilization for what we really need in the world to make the people go. And as it was mentioned, it's not now the political will, it's the political action. How to do it? Together we can. I'm really honored to participate and be one of the team. And we can assure you that we can do together a very good job. Thank you very much.
Thanks, Dr. Shireen, for your clear call to action on cost reduction and access to drugs. Thank you very much for your thoughts. Now I have pleasure to welcome Homi Razavi, who is a Managing Director for Center for Disease Analysis, USA. Thanks for joining us today. Over to you, Homi.
Well, thank you very much for the invitation to participate in this meeting. We're all here because viral hepatitis is the leading cause of death, any infectious disease in the world. And this is important to us. If we go to the next slide. These are my disclosures. I have nothing to declare. We do get grants from a number of organizations around the world. Majority of our grants actually comes from nonprofits and government organizations. All right, so there's going to be next slide. A lot of other speakers are going to talk about viral hepatitis elimination targets, how to get access, how to pay for it, and how to create awareness and to get patients on treatment. I'm going to focus on systematic challenges. So let's say that we can actually get the funding and we can actually provide access. There's still some major global barriers that keeps countries from actually accessing medication and from patients accessing medication. So what are some current challenges? And these are challenges that we've run across, and I know the government in Egypt has also run across. We have had a number of discussions. Countries around the world, especially in low and middle income countries, require that all hepatitis diagnostics and treatment be registered. And unfortunately, many of them require that they have to be re-registered every 2 to 5 years. Well, this reduces competition and keeps the prices high, actually. So if you are a government, and Finn mentioned, the need for governments to really get involved, and you want to actually donate hepatitis medication free of charge to a country, you actually have to go through a 6 to 9 months registration process before you can do that, or you have to get an exemption. And I think this is really important. This is not for viral hepatitis alone. This is for any medication. Countries for a long time have gotten used to the HIV, TB, and malaria programs, which essentially have unlimited funding and keep throwing money and do these programs in place. Viral hepatitis is operating on a shoestring. So we really need to make systems much more efficient. And one potential solution is to have mutual recognition. We don't need to register in 200 countries around the world. If they're registered in a few countries, then other countries need to start actually recognizing that and be able to allow importation. The other big one is national laws prohibit countries to include international pool procurement, international tenders. Sounds absolutely absurd, doesn't it? And you have to have local agents that are registered in that country bid on tenders. Again, this has a major impact on how countries can actually access drug. Everybody's talking about access of viral hepatitis, HCV treatment in low and middle income countries. We've had many people complain about the pricing, given that Egypt can get such low prices. But the fact is there is no competition. And unless you're a registered agent in the country, you can't even bid. Again, this is a very, very simple requirement. All national laws need to do is allow for international tendering. So that allows to actually put them to a tender and allow pool procurement. So you can have organizations like UNDP, WHO actually provide that to countries that are on essential medicine list. Countries collect tariffs. Look, unless you're donating a medication, if you are actually going to provide a low-cost treatment to a country or diagnostics, you end up actually paying money. It sounds absurd, but those tariffs could be as high as 35% actually. Again, what we're talking about, a way to get around that is develop essential medicine lists, diagnostic lists, to allow them to be exempt from taxes and tariffs. And of course, what we'd like to do is have viral hepatitis medication and diagnostic on that essential medicine list. And the second to last one, one of the big trends globally is now to push down treatment of viral hepatitis to general practitioners, to GPs. We've interviewed lots of GPs, and there aren't many GPs sitting around wondering what they're going to do next. They're incredibly busy, and they don't make large salaries, and they're not looking forward to taking on millions of new people to treat. And there's a very easy solution around that, is to simply create incentives to GPs for how many patients they see, how many patients they follow up on, how many patients link to care. There are a number of studies that show these are incredibly effective. And we've seen in countries like New Zealand, where the percent of all patients, Hep C patients that were treated by GP went from 5% to 70% within a few months when incentives were provided. And finally, 10 to 20% of all medicines in low middle income countries are expiring before use. Sounds absolutely criminal, but we as an organization have lost close to $1 million in products due to expiration. And we know countries, we're talking literally millions of donated medications is actually expiring either in customs or they get to the country and the programs are not in place to actually distribute them to the patients. And this is really important. We all need to work with the countries to develop very comprehensive elimination program that includes awareness, screening, linkage to care, and treatment. In conclusion, next slide, please. Many organizations around the world, and there are great examples on this panel, have been working to help countries achieve WHO elimination targets. What we need now is countries themselves to actually change their current practices that was unfortunately unhealthy and were developed over the years as part of the HIV, TB, and malaria programs. And these practices need to change to help these countries help themselves and the population. So I'm going to take this opportunity to call for action for countries to start actually doing what they need to do to get access to these diagnostics and treatments. Thank you very much for the invitation to be here.
Thanks a lot, Dr. Homi, for your practical suggestions. Thank you very much for joining us today. Thank you so much. I have now Mustafa Moram from Moram and Partners, Chairman, taking care of public communication and policy. Welcome, Mustafa, for you and the organization we are working on the communication front. Over to you.
So good afternoon, everyone. I'm truly delighted to join you today from the beautiful city of Alamein. It's actually on the shores of the Mediterranean. So I would love, of course, if all of you could join us next year. Maybe Dr. Hala, you may consider actually hosting a physical, actually, of course, session next year where all of those esteemed experts come and join us here at the North Coast to actually celebrate more and more achievements toward the elimination of viral hepatitis. I'm actually honored to be here today to discuss the critical role of public communications and awareness in the effort to eliminate viral hepatitis and to highlight the remarkable success story of Egypt, and which holds invaluable lessons for the rest of the Middle East and Africa region. Of course, I'm not basically a medical doctor by training. I'm a political scientist and actually a communication professional. So I'll be focused on how we could draw on the experience of a truly remarkable lady, Dr. Hala, and this is not a compliment. I've heard many of the speakers today speak about her, but I still believe that we didn't make enough. Basically, of course, we didn't celebrate enough Dr. Hala in the international media and the achievement that we're all talking about today. I think we definitely need more communications on global, regional, and local levels to be able to reach the level of mobilization that many of you actually, of course, are calling for it today. So again, this is at the heart. Dr. Hala leadership is at the heart of this historical, actually, of course, achievement in Egypt by launching one of the most ambitious and successful public policy campaigns the world has ever seen, as witnessed and evidenced by the number that many of you shared today. And one of the critical aspects of actually Dr. Hala's, of course, communication strategy is the recognition that this devastating disease was not only a major public health crisis in Egypt, but also a critical barrier to Egypt's social and economic development, which I believe is something that was very important for government decision makers. And moving from political will to political action, you need to bring forward new arguments beyond, of course, the public health arguments to make sure that we are able to convince decision makers of the necessity of taking more actions. To her tireless advocacy and collaborative approach, Dr. Hala, of course, secured the highest levels of political will and investment in the National Hepatitis Elimination Program, as witnessed by the personal involvement of His Excellency Abdel Fattah al-Sisi and actually all of the state organs of Egypt in the campaign. So again, bringing together for the first time policymakers, private sector, great companies that wants to, of course, to advocate for the cause, healthcare providers, civil society leaders, and international partners, and united them around actually, of course, a shared vision on how to basically having a hepatitis C-free Egypt. So again, the results of this multidimensional effort were truly remarkable, staging the 98.5% cure rate that we have now. Again, this had impressive results even on a global level, as Dr. William was saying, that now in terms of the prices of antiviral treatments in Egypt, basically it was actually treated at $58. It actually contributed to the lowering of prices actually worldwide. So again, this approach trickled down to accessibility and was able basically to influence how the economics of course, of accessibility, and of course that had an impressive result, whether in impressive results whether in Egypt or worldwide. So again, as we've heard, this experience holds immense relevance for the rest of our region. After all, we face many of the same challenges when it comes to actually viral hepatitis, from high disease burden to accessibility barriers. By learning from Egypt's success and adapting its approach to different local contexts, I firmly believe that we can replicate this remarkable achievement. But for that to happen, the leadership and commitment of policymakers will be essential. This is the ultimate lesson of Egypt campaign, in my point of view. And how basically are we able as an alliance to actually to work toward actually this, and making sure that policy making actually that we are able to move from policy and from political will to political action. I think at the heart of this is what I call, and I'm indoctrinating a new basically term today, which I call the HALA effect. And basically how basically under of course the commitment of Dr. Hala, her ability to unite stakeholders and her focus on empowering community, I've thought about it from a communication perspective, and again, no communication strategy can fully capture it. We cannot just basically have a framework and send it to different countries. It will not work. There are so many variables that decision makers like Dr. Hala needed to navigate in order to be able to bring together this framework and make it successful and make it happen. So how to bring this experience to actually to the rest of the region? This is actually the interesting advocacy and communication challenge that basically that we need to think about. And that's why today I'm actually calling, or my key recommendation or call to action is to call as part of this alliance to the establishment of a regional advisory board. Again, we need basically such a setting with the highest level of decision makers in the region. I'm talking about the Middle East and Africa region here, but of course it could be replicated also elsewhere, having the ministers of health as part of a setting, basically with actually plus Dr. Hala and the Access Health team to do what I call to educate and inspire high-level decision makers across the region, and as well as adapt and adopt the successful strategies in the respectful market. To actually the setting coupled with one-to-one engagements with policymakers and providing them with, again, practical, strategic, and tactical advice. This is basically, ladies and gentlemen, very important. Many of the decision makers and the political basically actors want to start something, but they don't always have either the strategic framework or the tactical know-how. Many of the questions that we have is where to start and how to practically basically navigate the scene with different players, with of course challenges related to accessibility, to communications, to how to communicate with highest level of government regarding the importance of mobilizing more budgets actually for such campaigns. Those practical, strategic, and tactical advices are what are needed in order to make of course to make sure that we are able to move forward basically on this front. So again, to this setting, this advisory setting that we could all call for and make sure that basically it happens under the leadership of Dr. Hala, will be able to create and empower a new generation of policymakers championing the elimination of viral hepatitis in the Middle East and Africa region and beyond. To sum up, ladies and gentlemen, we need more HALAs region-wide. Thank you very much.
Thanks, Mustafa, for your thoughts and views. I think it's very encouraging to look at amplifying how communications make a different role. Thank you so much. I now move and I have the pleasure to welcome Dr. Krishna Reddy, who's been inspiring and looking forward the entire work of Access Health International as a CEO. I have the honor to welcome Dr. Krishna Reddy. Over to you, sir.
Thanks, Girish. I think, and also I thank all the participants today on behalf of Access Health. I think everybody agreed that there is enough policy awareness, global, regional, and national policy awareness. Some of the countries do have enough policy attention. But if they have attention, some of them may not have the resources, some of them may have the resources. Some people have the resources, but they don't have the capacity, infrastructure capacity, or the capabilities. So the objective of the Alliance and the role of Access Health as its secretariat, as well as the passionate supporter of this mission of eliminating hepatitis, is to play the role of orchestra conductor. And what we need is, we have stakeholders, everyone is interested in eliminating hepatitis. But what we need is a conductor to connect all the stakeholders and achieve that cohesive coordination among the stakeholders and a collaborative action. And also take some of the guidelines that emanates from the knowledge of the WHO at a global level, how this alliance can be the torchbearer to take it to the regions, take it to the countries at a national chapter level, and take it to the subnational level, and take it to the local level. That's how the Access Health has been operating the various networks and the collaboratives in terms of how do we connect the local to the global? How do you connect the stakeholders for the policymakers, the providers, the producers, the professionals, the patient groups, and the philanthropist? It's only connecting these dots. Somebody has to artistically orchestrate to produce the sound of music. That can see the elimination of hepatitis. I think that's what the future action plan. And as Dr. Hala has already highlighted in the future forward, she has created those 3 action points. Many countries actually require the practitioner's wisdom of what Dr. Hala carries of eliminating hepatitis from a country. So that's where exactly how it was done in one country at a system level. We have the drugs, we have the access to the test, we have the access to the money, but the system has the weaknesses in terms of the process, in terms of the people. I think that's where the toolbook, is going to be one of the key immediate output of this alliance. That's what I see as a future course. And then if we can actually demonstrate a success story in Uzbekistan, because already we have the things have moved and there is a MOU signed, there is a policy interest, but what they require is that handholding in terms of the practitioner's wisdom of how one country has eliminated hepatitis. Can it be actually replicated in another country, maybe with adoption to the local context? But at the same time, that is rare to get, because people may give money, but they may not give the knowledge and the capacity and the tools to actually execute at the ground level. I think that's what I see. And fortunately, we have the experience, a similar experience in the CVD control, and we are starting with the cervical cancer elimination. And we have a collaborative for health systems resilience, building strong, secure, and resilient health systems. And Access Health was fortunate to be one of the co-founders of the Joint Learning Network. How 54 countries can come together and learn from each other. The same philosophy of learning from each other, handholding in actually executing through the translating this knowledge into the action. So I strongly have a belief, in fact, in the short period, the ability to bring the speakers today, who represents some of the top global organizations, that itself is a bold step, the first step on the journey of 1,000 miles. So I think I have no doubt. I think whatever mission with which this alliance has started, we won't stop it until we achieve that end goal of eliminating hepatitis. Wish all of us best. I think it's a collaborative effort. I always say that it's self-organizing, self-governing, and self-sustaining alliance. So that is the spirit. I mean, that is the spirit of growing these alliances with the passion as the catalyst. I think with these few words, I think I again thank all of you and looking forward to actually growing this family of collaborators, family of missionaries to a much larger number at regional level, at national level, at subnational level. Thank you all.
Thank you, sir, and thanks for your views. And we have actually overshot our time by 15 minutes today, but I see a lot of passion and interest from all our panelists, and they've been really thought-provoking call to actions and what we are looking at in a divergent way, solving the problem. So given that, I thank once again to all the panelist speakers for giving their time and also giving valuable messages, what as an alliance we should look at going forward. Thank once again for joining us today, and for sure we'll carry forward the message today into action. And I thank everyone, and I thank specifically Dr. Hala for championing this alliance and this initiative and championing to take it on a global level. Thank you once again all for joining us today. Thank you. Thank you.